Well, good evening. I'm Jennifer Blomquist, and welcome to Healthline. I have the privilege of hosting the program tonight. I'm so glad you joined us. We have a wonderful guest here tonight. She's a local physician who specializes as an allergist and immunologist, and she is here to answer your questions. So nothing in life is free. I'm sure most of you know that by now, but this show is totally free. You get your questions answered for free and free help. So take advantage of that. That's why we keep that phone number up at the bottom of the screen throughout the show. So it's 969-2720. If you're outside of Fort Wayne, put an 866 in front of there. That makes it a toll-free call. When you call in, if you have a question for our doctor, you have two options. My favorite option is that you call live, because if you do that, you can talk to the doctor. She might need to get more information from you to give you a better answer to your question. So that's a great option. But if you'd prefer not to do that, go ahead and call in, and you'll talk to a call screener, and then that person can take your question, and I'll ask the doctor the question for you. So two ways to go about it. Either way, you get your question answered. So let me go ahead and introduce you to our guest tonight. She's brand new. She's never done it before, but she's going to be great. I can tell already. This is Dr. Vanessa Cavero, and Doctor, you specialize as an allergist and immunologist.
Yeah. Good evening, Jennifer. Thank you for the invitation. Yes, I specialize as an allergist immunologist, and I see kids and adults. Mm-hmm.
Wonderful. Mm-hmm. And I'm so glad she came to join us tonight. I have to just put this in. She is new to this region, and she moved here from Florida, which I said, why? But so this is her first winter here, so we were chit-chatting all about the cold and everything like that. But, you know, speaking of weather, I always think that weather impacts allergies. You know, it seems like right now, my husband, if it's in the spring, he's taking allergy medicine round the clock, but people with those kinds of allergies kind of get a break, the seasonal ones. I feel like in the winter, they get a little bit of a break. Would you agree? Because of the cold, it kind of keeps it better.
Exactly. So when we are in the spring and the summer and the fall, we have different pollens out that are the major responsibles of those people suffering from allergies during that time, right? But once we get the first frost of the year in the fall, after everything dies, so the people that are allergic to those specific pollens get a break, like you're saying. Right, but of course, other things to start, like the respiratory infections, like in kids that have already allergies, or persons with allergies, that can be a little bit more you know, like hard for them too.
Oh, sure, sure. You know, and we hear so much about allergies today. I mean, I'm in my 50s, and I feel like when I was growing up, I mean, like my brother and my dad would get the seasonal allergies, but I never heard of the other kinds of allergies, like the peanut allergies, all these allergies to certain kinds of food, you know, dairy or things like that. That seems to be so much more prevalent. So do you think that is it because we live differently, or, you know, maybe we have different diets now compared to many years ago? Or did those problems exist before, but we just didn't really know it?
Well, definitely what you're mentioning is something that we have noticed in the world. Allergies are becoming much more prevalent to the point that we're calling them an epidemic. Yes, of course, we wonder what is this going on, and we can say, you know, as much as there are genetic factors, you know, like when there is family history of having allergies, also there is very important the environmental factors, like what you were mentioning. Yes, there are many things around, and in fact, I feel like in these days are the ones that are impacting more, because having a genetic change takes much more time. But it seems like this came as a burden. So the eyes are put right now on the environmental factors. Yes, there have been lately many studies trying to, you know, to see what are the reasons, why is this happening? No? For example, we know that when you are exposed early in life to smoke, that predisposes you to have allergies later in life. For example, we know that kids that are born and they suffer from a specific viral infections or encounters with germs and pathogens, that can put them on a higher risk of developing allergies, right? Another factors, like for example, breastfeeding. Breastfeeding could be a little bit protective, right? But for the kids that didn't have it, then they have a little bit of that disadvantage. And exposure to antibiotics early on in life can also be related to having increased risk of developing allergies.
And it's, it's a challenge. It really is, because it doesn't just impact that child, but, once they go to school, I know my daughter, when she was in 4th grade, there was a child who couldn't have peanuts, like even if it was in the room. It didn't have to be that he ingested it or touched it, but nobody in the room could have any peanut products or he could have an issue. And I just thought, holy cow, that's all, that impacted how they ran the classroom. They banned snacks that year. They were just too afraid that some child might forget and bring something with peanuts in it. So it does have a big impact, not just on the child, but just other people they interact with.
Absolutely. Restricting a specific food has an impact in everybody, because those other kids that are not allergic, then they cannot use that protein.
Right.
For example, in the case of peanuts, it's an excellent protein, but if you have a kid allergic in the class and it's banned, like you said, then everybody gets the disadvantage of not eating that.
Yeah.
So it seems like a little unfair sometimes, and we in general, as allergists, we want everybody to be prepared for the worst case scenario and have epinephrines where they have to be, all the kids identify. Not so much about banning foods. It's mostly like just be ready in case something happens.
Yeah. Do you find that some kids outgrow some of these food allergies? Is that common, or because I've heard of some kids I don't know if it would be really like an experiment, but they'll do something like, I knew a boy who had a peanut allergy growing up, and now he's in college. And I was just talking to his grandma the other day, and she said he's been starting to do like eating just a few nuts every day under a doctor's supervision.
Yes.
Yeah.
Well, yes. Going with the first part of your question, yes, there are many allergies that kids cannot grow, and that's why food allergies is very strong when you are taking care of pediatric patients.
Sure.
There's allergens like milk, egg, wheat, that you can definitely grow by the time that you're 8. Hopefully you're grown. That's the natural history. Although now we're seeing some special cases that continue to have the allergy, but that's not the common norm. But there is other allergens, like for example peanut and shellfish and tree nuts, that tend to stay with you. If you have them by the time that you're in puberty years, probably that's what it's going to be for life. And what you were mentioning, yes, there is now oral allergy monotherapy, which we can offer for some patients. It's like a process it's not for everybody. It's just allowing these patients to eat a specific amount of the allergen, so that way they can feel more confident when they go out and they encounter traces, so they probably are protected to that. Right?
Yeah.
So that's something that is coming in the later years, but it's not curative. And once again, it's for specific patients. Not everybody will benefit from it.
All right. I just want to remind everybody that they can call and ask a question, because we haven't had any calls yet and the phone lines are open. We'd love to hear from you. If you have anything allergy related or immunology related that you'd like to ask Dr. Cavero, please call. Again, there's a number at the bottom of the screen. It's 969-2720. It's still a toll-free call if you put an 866 in front of there. And again, our time is limited. We only have Dr. Cavero for about another 20 minutes, so call sooner rather than later. In the meantime, we're going to keep talking about this. What do you advise people to do if maybe you have a relative who has an allergy or some type of issue, and then for people starting to have their own families or own children, are there precautions you need to take, or just things that you need to watch for? Because you mentioned it can be, the hereditary factor can be strong.
Yeah, well, it's always, important to just know the history of the family. If somebody of the parents or previous siblings have, definitely the risk of that kid that is going to be born is a little higher. And I think what you have to do is just pay attention, like we were, I think a very interesting concept to just let everybody know right now. We talk a lot of what is the atopic march, which is just the sequence of these atopic conditions and how they present over, the span of life in childhood, right?
Is it atopic march?
Atopic march, yeah, which is just the sequence. Like, we don't know exactly one is the cause of the other, it's just, one comes and then the other is independently coming, but the most evidence that it's out there, it's eczema, probably the first one appearing,
and
exactly, and that's a sign that you, for example, have to pay attention if you have this family history, and a child that starts developing a rash.
Okay.
There is eczema that is mild that can definitely be addressed by the general practitioners, but if that eczema becomes a little bit more severe, or there is other components of the atopic march, like for example, concerns for food allergies or reactions to foods, or even wheezing or respiratory issues. So that kid definitely has to be evaluated by an allergist. And those are the things that we have to pay attention for.
Yeah, I was gonna ask you, like, what if you have a child who has a peanut allergy and then you're having another baby? I mean, should you just not let that baby have peanuts, or could you maybe give them just at the doctor's office try and do it? Or I would be terrified, not know. Or is there testing that you do at a certain age?
Absolutely, yeah, definitely. The parents come with that question. Is very common. In general, we will not tell a kid not to eat peanuts just based on the brother or sibling having that allergy.
Okay.
In the past, some trend was about testing them before, but no, we do not advocate for that anymore. What we will do is assess the risk, right? Definitely genetically they have it, but if this kid, you could, do some testing and kind of evaluate the risk, and in order for try to introduce the food in a safely way, right? That's what I would advise, right?
All right. Yeah, it is a frightening thing for a lot of parents, especially when you have to send your child to school and you're not there to supervise all the time. So
yeah.
that can be, I would imagine that'd be pretty stressful. So again, I just want to remind everybody we have the phone lines open, and Dr. Cavero is here to answer any questions you may have. I know I meet a lot of grandparents who this is kind of a new thing, having a grandchild. Maybe their children didn't have any of these allergies, but now they have grandchildren with allergies. So Dr. Cavero is your source for great information if you want to call and ask her a question. Again, she's only here until a little before 8 o'clock. So what would you recommend that people do as far as preparing, just to be prepared, like wherever you go? Do you always have to have medicine with you? Or I mean, I'm just thinking, you go to a restaurant, do you just, I don't even know how hard, I guess I've never really paid attention to if they mention like on a menu, some of the, oils or things, because, there could be peanut oil. What do you always recommend to your patients to keep themselves safe just when they're out and about?
Yeah, of course, when somebody has a food allergy, I guess that's the patient that, of course, we have to be careful. No? These patients, of course, have to have, have to be evaluated by an allergist, and they have to have what we call an action plan, which is, this patient has his medication, epinephrine, and other medications like antihistamines in case they have there's different types of reactions. You can have a mild exposure, just just where happen to try it but not necessarily ingest it, and you can manage that with an antihistamine. But if you have a reaction, then that's why you have an epinephrine that, and the plan is should be clear enough to, educate the family and the patient on when to administer the medication.
Right.
Now, if you're going out, of course, we will recommend that you have to take your epinephrine with you wherever you go. Sure. Because we know that they are not purposely ingest the food. All this is preparation for anything that happens like as an accident, right? So when you go to restaurants, we always advise our patients to try to pick. It's hard, especially shellfish and fish. It's always something that it's mixed. You don't know exactly what's happening in the kitchen. So in general, I recommend my patients, if you're gonna eat, let's say you're allergic to fish but not to shellfish, or vice versa, because that can happen. You don't have to be allergic to both of them. They're different. Just please, if you like the other food that you are not allergic to, try to eat it at home and you cook it yourself, or your
that's
parents
probably
or
what
family.
I would do.
Exactly.
You just don't know about the cross-contamination at a restaurant. I mean, you think about how busy a kitchen would be, and they may not be able to avoid it.
Exactly. Even if they tell you, I always, and once again, be prepared. You have your epinephrine with you. If you're going out, you just have to be prepared.
All right, smart idea. We actually have a gentleman who is waiting to ask you a question. So, Steve, take it away. You have a question for Dr. Cavero.
Yes, I'd like to know about the connection between itching and primary sclerosing cholangitis.
Okay, so The itchiness in this,
what is
well,
that?
this condition is not an allergic condition, sclerosing cholangitis, but as a doctor, of course, I can bring a little bit of reference. The itchiness that you have in this condition is secondary to increasing some of the liver enzymes in our body. So that itchiness is a different way. It's not necessarily has to do with histamine. So this will be a different type of patient, not necessarily an allergic patient.
Okay.
Yeah.
I don't know if Steve, are you still on the line?
Yes.
Oh, did you want to ask did you have anything else you wanted to ask Dr. Cavero, or did you need more information?
No, I was just trying to determine whether or not there is a connection between the two conditions, the skin itching and the cholangitis.
Yeah. Like I said, I would definitely recommend that you get an evaluation by your primary care to determine, but most of the time, unless there is something else in the history that, you may have also allergies, this type of itchiness on the skin is for a different reason.
All right. Thank you so much, Steve, for calling. I appreciate the question. While you were answering that, we did get somebody else who called in, a woman named Sarah, but she wanted me to ask the question for her. So Dr. Cavero, Sarah is asking, when it comes to dust and mold, is that usually, when you hear about people struggling with those kinds of allergens, is it mostly children or adults? Yeah. And then she wanted to know how you would get tested to determine that.
Yeah. So, of course, adults and kids can be affected by mold allergy, and it's quite common. And definitely, if you are evaluated by an allergist, part of the regular, I would say, skin testing that we do in the office, or that any allergist do in the office, includes fungal spores, which we commonly call molds. And yes, you can be tested, that allergy can be identified and treated with medications, or even allergy immunotherapy, which is specific to the molds.
You know, years ago, I know they used to do the testing on the back. They would like draw a grid on your back and then just use the different little prongs. Is that how they still do it?
Yes, the test
They still do it the same way? Okay.
Yeah. What things that I have changed is very minimal. Is like how you prick the pricks, but the basics and the principle of the test is the same. Basically, we expose the patient to that allergen, and the immunology cells which are on the skin react to that, which give us an answer very fast, and is the best way and the one that we all prefer to evaluate our patients.
And growing up, I used to hear about people getting allergy shots, kids and adults regularly, and I didn't know how common that was, or if there are other ways besides just having shots regularly that you could, manage severe allergies. Yeah,
that's, again, one method that has been there many, many years, but we still use it, is subcutaneous allergy immunotherapy, and is very effective, controlling symptoms. It also resets our body in a tolerant state, so hopefully you will not get more new allergies, and it also improves an asthma when the asthma is allergic. So it's definitely a therapy that we, allergies is one of our big guns that we rely on and that we use to treat daily our patients.
Okay, interesting. We have another person who called and wanted me to ask the question for them. So James called and wanted to know, can you grow out of, you were talking about asthma, can you grow out of asthma like you can with some of these other food allergies you were talking about?
Yes, absolutely, you can. You can grow, and it's exactly what I said, we don't know who exactly, but yes, of course, you can grow. Typically, the majority of kids, that they are wizards when they are little, when, they will eventually grow. Yes, there is some that will continue with the condition, or some that will be worse, but in general, the majority of them will outgrow it.
I was going to say, you probably do a lot of interaction with your patients, and maybe over time as as well, because it's something that if it's an issue you're dealing with, you're going to have to. I mean, like how regularly
through life,
but how regularly? If you have a severe allergy, do you need to go see a doctor every month, or do you manage your symptoms on your own for a while? Or I just wondered how much care it requires.
Exactly. So when you have you suspect of allergies, of course, you always have your general physician. You can be treated with medications, but when that's not you don't have a solution to your symptoms, we recommend that you are evaluated by an allergist to determine in the first place if this is allergies, right?
Okay.
Which will probably be the most common cause, but that you can just say it after an evaluation.
Okay. All right. And we have another person who wanted me to ask the question for them. So Pete, thank you for calling. And he wanted to know, when it comes to allergies, would you recommend a nasal spray versus oral medication? And if you, let's see, if you take both, can you over-medicate? Yeah, I didn't think about that. So is there one that's better than the other, the spray versus taking something orally?
Yeah. So both of them are helpful. The nasal sprays are, of course, our favorites. They go directly to the mucosa, and they take care mostly of the inflammation.
Okay.
The antihistamines may deal more with the symptoms, for example, runny nose or postnasal dripping.
Yeah.
So both of them have their specifics. But yes, most of the time we prescribe both of them together. And if you are using it correctly, as your doctor is indicating them to you, you should not have problems. So that risk about over-medicating is minimal. It's going to be basically if you don't do it following the instructions.
You know, and I just know a lot of people who have allergies that I had never really heard of this until recent years, but a lot of them say it's not like a medicated spray, but just a saline type of, like, they'll say like, oh, if I rinse my nose out with this saline spray, it just, I guess they tell me that it feels better, or at least if they feel like they've kind of cleaned out their nose better. I don't know if that's a common practice or not. But
so I guess, yes, to clarify is good. I guess I was talking more about a nasal spray that is steroids. That is
like the
one,
medicated ones.
But there is other ways that you can clean that part of the airway, the nose, which also helps. And there's other mechanisms to clean the nose and the sinuses. But that will be like typically just to clear from secretions or some like sort of debris or anything in there, which also helps on the management of allergies or chronic rhinosinusitis. But it's not, it's different than the steroids.
Sure. All right. We have, I think, a couple minutes left. So, I mean, we could probably squeeze in a real quick question. Just want to let you know that if you want to give us a call real quickly at 969-2720. And Dr. Cavero can answer your question for you. I was just wondering, I know it's hard to think about it now, but spring isn't that far away, depending on, I guess, what Punxsutawney Phil out in Pennsylvania said we have 6 more weeks of winter. Our local groundhog, I think his name's Charlie, he said that we're going to have spring, 6 weeks until spring. So either way, the change of season is coming up. What are some things that people can do? If you suffer from springtime allergies, a lot of people just dread it. Are there things you can do now that would help you to maybe make it a little easier of a transition going from winter to spring?
Well, just, if you know that you have allergies to tree pollen, which is the first one coming.
Okay.
It's the first type of pollen coming. Just you're up with your medications or have a plan with your allergy. Visit your allergist around that some weeks before. Yeah. Just to make sure that you have all your prescriptions filled. And I don't know if you have discussed about doing something else, maybe, considering the allergy immunotherapy, the shots. Commonly known as shots. That's something that also, I will be ahead and starting it before the season.
If you start doing shots, is it, there are some medications, I'm just thinking like for like other specialties, like a heart issue. There's some medications where once you take it, it's like you have to take it for the rest of your life. But if you do the shots, and you don't like it or it's not working, is it a commitment? Are you committed to, do you have to stay with that, or can you stop?
Well,
I didn't know how that worked.
So allergy shots are a big commitment from the patient, like you said, and it takes time to build, you to the dose that we want you to be and to have the full effect. So yes, it's a full commitment. You have to be weeks, months building up,
and then okay.
And then maybe years on maintenance, between 3 to 5. That's the recommendations. So usually they are pretty good, but if they are not working for you, of course, there's always a consideration about like stopping the treatment. Yeah. But every time I'm gonna start one of those in any of my patients, we sit seriously, we say, this is your time, so we need to make it worth.
Yeah, yeah.
Right?
It is it is a
It's
commitment,
a commitment.
you know. Yeah, when you're saying that, I mean, I guess if you get to the point where it's bad enough that you just you're willing to do anything to get relief, I guess it'd be an easy commitment.
Yeah.
But
Yeah.
all right, good stuff to know. So we appreciate you coming on, Dr. Cavero. It was our first
Thank
time
you so
ever doing this
much.
show, and I told you you'd be a pro. You did a great job. So thank you so much. And many thanks to all of you who called in tonight. Great questions. Really appreciate that. So take care. Have a good rest of your week. We have another Healthline coming up next week. Mark Evans will be hosting that one. They're going to be talking about cardiac rehab and therapies that are available for cardiac patients. So it is Heart Health Month, so join us next week, next Tuesday evening. In the meantime, take care. Have a good night. Bye-bye.
PBS Fort Wayne was made possible in part by
momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.